instead I'll be talking to you about social connections, substance use, and society. And so, was everyone just using the right key? Oh, it's the up key. There we go. Down key. There we go. Okay. So, as many of us know, substance use is prevalent in our society. We see it in places like weddings. We see it in films featuring like the trope of a wine mom. We see it in family settings in movies like The Fighter, based on a real life story and how it plays out in a family setting. And more recently, I'd be remiss not to mention Euphoria, as we see it play out in the young adult and teen setting. And so we already know that there are several things connecting social connection and substance use. Starting at a young age from the initiation, it matters like who your friends are, what groups you're in, whether or not you initiate substance use. And then beyond that, whether or not you go into a substance use disorder and whether or not you're able to enter recovery from that is also related to your social connections. And so the question I want to ask today is social connection especially relevant for people who are using opioids? So we're going to explore this question from a micro to a macro level, starting with some neurobiology stuff. It'll be brief, I promise, to the individual level, then a group level, and lastly, looking at it from a societal perspective. So some background to this work is this concept of the heroin hug. And this is the idea that opioids feel like a blanket. They make people feel warm and secure and loved and happy. And so what I wanted to do was to quantify this. There's a lot of kind of, I don't want to say hearsay, but like places like Absolute Advocacy, or you see this on news stories sometimes of paramedics that work with people that use drugs, that are saying opioids feel like a hug, but there wasn't any evidence out there affirming or denying this. And so back to the neurobio here of why this might be the case. So we know people are saying it, organizations are saying it, people that use drugs are saying it. Why could this possibly be the case? So if we look way back to rodent literature in the late 70s and early 80s, Panksepp et al. Came up with a theory called the brain opioid theory of social attachment. And essentially this posits that our endogenous opioid system, so our brains naturally produce opioids, we have different types of receptors for those, that those are relevant for social connection. So we see this with rodents and social play when they do, like if you've ever seen little kids play with each other, they're kind of wrestling around. That releases endogenous opioids associated with kind of pleasant social connection feelings. Maternal infant bonds can be heightened or kind of messed with actually when they do work in like rhesus monkeys and things like that. So babies that are administered naloxone increase their mother-directed poos. And so naloxone is an opioid antagonist. It blocks those receptors from doing what they normally do. And then morphine reduces these contact reunion vocalizations. So the baby is less happy to see the mom if they're administered morphine, which is an opioid agonist. And then in people, we cannot, for research purposes, split up mothers and babies. So what they do instead is they stick them in a scanner. And so they have people watch videos, and after the experience of a positive emotion, people are releasing endogenous opioids in the brain. And lastly, between people, if you're doing, like, if any of you, I know there's some recent moms in here, partners are usually allowed in the delivery room. There was a lot of research in like the beginning of COVID when partners were not allowed in the delivery room. Your pain threshold goes up when you're surrounded by loved ones. That goes away if you're administered naloxone, an opioid antagonist. And so essentially there's a ton of evidence across all types of different mammals for the brain opioid theory of social attachment. And so the question we wanted to ask was, does acute exogenous opioid use, so now I'm ingesting an opioid not from my body, so heroin or fentanyl or something like that, does that actually produce feelings of social connection and warmth? So what we did is we asked a whole bunch of people, 289 of them, who use alcohol, marijuana, methamphetamine, prescription opioids, and non-prescription opioids. We said, okay, in the initial stages of your use, these are all folks in recovery, when you first started using, however long ago that was, did you feel excited? Did you feel happy? Were you content? And were you satisfied? How did the drug make you feel? And then we also asked them specifically about social emotional questions. So we asked them, okay, when you were using, did you feel loved? Did you feel like a hug? Did you feel a sense of belonging? And did you feel secure? And so what we end up seeing here, this is a graph here, primary drug of choice on the bottom, and your positive non-social emotions. So that's the happy, excited, content feelings. We see no difference. Generally, people are pretty happy. This is a 1 to 7 Likert scale. People are hovering at about, 1 to 5, hovering at about like a 3.7 to a 4. No surprise here, drugs make people feel good. That's generally the initial stages why you're using them. And so we do see a different pattern when we're looking at these social emotions specifically. So now here we see a difference between people who are using opioids. They are showing a statistically significant increase in positive social emotions. So when we looked at which specific emotions were driving this effect, we saw that people who use opioids specifically are saying that the drug felt like a hug and that they felt secure more than people who are using other drugs like alcohol or meth. So beyond that, we looked at other things. These are people in recovery, so it's not just the initial stages. We can ask them about all the different stages. So we looked at the initial stages of use, their chronic use, when they first started to quit, and their post-cessation. And so we were thinking, okay, well, if people feel secure and hugged and all these pleasant social things, is it because they had some sort of deficit before they started using? So what we'd want to see here is this is now on the x-axis instead of drug of choice, we have a timeline. So the before use stage, we would ideally like to see, to confirm what we're thinking here, that people that use opioids are scoring lower and that they're using this as kind of a self-medication to replace those positive social feelings. We do not see that. They are the same as everyone else. Marijuana actually was a little bit lower, although it's not statistically significant here. This red line on the top is a group of people who are not in recovery. So it's a standard control group and they're scoring higher. So we do not have evidence that people that use opioids are doing some sort of self-medication because of a baseline level of low social happiness. One interesting thing I did want to highlight here, though, is that people that are using non-prescription opioids, so illicit opioids, did have the only group that had a decrease here from the before stages to initial, which was interesting. And so essentially we don't have support for that people who are using opioids are showing deficits in social connection prior to the onset of use. I will highlight here, this is all retrospective data of people that are in recovery anywhere from 6 months to 6 years. So it is retrospective. And so going forward, we have 3 other time points. Let's see how those play out. So as we can see, I think most of you probably would have guessed, people are less socially satisfied as time goes on as they enter into a substance use disorder. And so those go back up into recovery, but do not meet the levels of people who are not in recovery. So it's associated with lower retrospective social life satisfaction among generally people who use drugs, and it's slightly lower for those using prescription opioids. One positive thing here to highlight is that people who are in recovery for a long time, this is a quality of life measure, 35-item scale, assesses lots of things. They look like the control group. So people in recovery have resilience, as we learned about earlier. So people are bouncing back to pre-substance use levels, it looks like. So at a community scale, just a quick note here on this graph, this is not something on an individual level we can ignore. So people who have really high levels of social capital, so your community has lots of volunteer things, people are involved in community service, things like that. Places that have high social capital have lower drug overdose rates than places that have low social capital, which is correlated with socioeconomic status and other things of that sort. And as I'm running out of time, I have future directions that I will briefly just tell you about. Super cool. People who are in recovery from opioids, we ask questions about different types of social situations. And so these are people not in recovery. We just ask them to imagine people are in recovery from different drugs. People think alcohol has like the highest risk of relapse if you ask a general population. But if you ask people who use drugs, people who use opioids have the higher risk of relapse than the other groups. So that's something that's interesting that we'll explore a little bit later. And I'd like to thank funders, collaborators, and IAS. And I will take questions.
Any questions for Nita?
You were hinting at in limitations in terms of these being people in recovery, and how do you think social desirability responses in recovery might impact this? And if you had to speculate how the data might differ among people who are active users, what do you think that would be like? And have you thought of trying to divide people between people who are tend to relapse versus people who have kind of very stable recovery, or all, I mean, you did show one kind of diagram as retrospective, but anyways, can you speculate kind of on how you think it might differ from people who are active users?
Absolutely, yeah. So we do have a separate sample of people who report current drug use that's not included in these analyses. So this is people who self-report that they're in recovery and that they're involved in some sort of recovery program, whether it's community, like a doctor, their family or friends, they just reported some level. I do think social desirability is something we have to grapple with, right? Like it's in the nature of what we're asking. And it also, I think, with this sort of thing can fluctuate kind of widely. So your social satisfaction, I know some of the graphs earlier were talking about over time during COVID, and the two lowest points for something were around the holidays. And I thought that was really interesting because it's probably related, like how lonely you feel. So I think in addition to social desirability, there's other biases of like time of year and like whether you were just rejected by someone you asked out. Those kinds of things definitely impact these scores. I would say it would likely impact them across the board for the substances. So hopefully it doesn't introduce too much bias between the drugs of choice, I would hope. Good question. Thanks.
Hi, Nina. Great talk and great research. I'm curious about your thoughts about implications for pharmacotherapy. We have some pharmacy specialists here in the audience, and oxytocin. There's been some discussions about its role in substance use. And so, have you thought about those types of directions for your research programs?
Absolutely. I would say I'm 1,000,000,000% an advocate for all medication opioid use disorder. I think that they should be utilized among any population seeking treatment. And one thing that you didn't ask about that also I just think about in general is AA seems to, and NA, the 12-step anonymous programs, do seem to be coming around to this idea. LA generally has a pretty liberal scene in that. And so the AA communities that I'm kind of in tune with are less dogmatic about being anti these types of medications, which I think is a really important and good step forward. Oxytocin's interesting. The original theory I mentioned, the brain opioid theory of social attachment, they're not directly anti-oxytocin, but they're like, we've spent so much time on oxytocin, we forgot about the endogenous opioid system. And then it was forgotten for 20 years, and now it's getting kind of popular again. So that's an interesting just kind of trend among research. But I think they could be used in unison, right? Like there's no reason that one has to be over the other. You can use both to include like feelings of positive social good warmth. Those are things as human beings we all want to feel, and it makes sense that people would seek out something that feels that way. Yeah, I'd be really interested in learning about the oxytocin therapy, though. I have not heard of that before. All right,
Thank you, Nina.